No, it's not. That was
Anyway, this is NUR 203 Exam 1 review, and I'm going to be going over it. Know that you will see theorists here in questions, and it's something that I'm going to try to explain in a manner that you can relate. You're going to see it on HESIs and you're going to see it on your NCLEX. So, theorists, yes, oh my goodness, but we're going to figure it out. Erickson is probably the most tested. It's all about the way they relate to society, people around them, if you think of Erickson. So let's go down all of the different things. We start with infants. These are what do infants know how to do? They know how to cry. And when they cry, why are they crying? They want somebody to pick them up. They're hungry, they're dirty, they have to burp, they just want you. So when you go in and you pick them up, they get that sense of trust and security, and they're happy, stress free almost babies because they know somebody's coming. Now, mistrust, what is that? Well, there are situations where parents or caregivers don't go in and pick up the infant, but not just once, all the time. This could be in a homeless situation, could be with drugs, alcohol, something's going on that's they're not paying attention to their infant. And this infant will have mistrust. They don't know that anybody's coming for them because that's all they want. So trust versus mistrust. Now, toddlers, my favorite group of children. Autonomy versus shame and doubt. Think of automatically me is autonomy. All about me, me, mine, mine. I want to do. And toddlers are into everything, right? And they want to try to do things, jump off of couches onto other things. I mean, they are Houdinis. And what is the shame and doubt? Well, I've heard it described as the helicopter mom behind the child, trying to do everything for them so that they don't get hurt, tying their shoes for them, getting them dressed because they feel they should be doing it. And that leads that toddler to the shame and doubt. We should allow toddlers to have that independence to try to do things and skills, and we need to just watch, unless they're going to hurt themselves, of course. Now, initiative versus guilt. These are your preschoolers. This is now children that want to do things for parents. Okay, they want to say, "Oh, mommy, let me get the silverware and set the table," or "Oh, you're doing laundry. Let me get the dirty laundry." And then the shame and doubt is they can't do everything, right? So they sort of feel bad because they are and guilty because they can't do some things. Now, going into school age, probably trust and industry are the two biggest ones that we see going forward into exams and tests and whatnot. What is an industry? Well, I describe an industry as a factory. It's what I produce. It's my product. What do I do well? My industry, okay? So some students run fast. Some children are good at math. Some kids are good at spelling. And they get praise for doing things well. So that's my industry. Well, they can't do everything well. So that's the inferiority. You may be very good at running, but you're not good at math. So now they feel inferior for that. So that is industry versus inferiority. And then we get to adolescence. That is that stage where who am I and what do I want to be and who am I going to hang out with? Who are my friends in them? And the identity is also about body image. What do I look like? Do I fit into that group that I want to fit into? And the confusion is I don't, I'm still confused. Do I want to be an engineer? Do I want to be a lawyer? Do I want to be in the art club? Do I want to be in the gym club? Do I want to be in the drama club? That's the confusion. They're so confused of which way to go for the future, right? So they want to figure out who they are, where they're going, but that takes time. So that's the confusion of finding their identity. Now, Freud, anything about sex, anything about sex. I think the only one of these that doesn't, the word doesn't get to sex is latency. But latency is all about school age children relating with people are same sex peers. They don't hang out with the opposite sex, usually. I'm not saying all, but usually that's what that means there. So start with infants. Everything's in their mouth, right? They suck, swallow, and breathe. First things they do. The next thing they do, they put their fingers, toys, everything in their mouth. They explore the world in their mouth. And those little pacifiers, what do? Those non nutritive sucking devices, they soothe. A soother is a great name for them because they can decrease their own stress. Now, anal stage is now your toddlers, your older toddlers, but now you're potty training. We know bowel training starts before bladder. So that's why it's now anal. Then we go into the preschoolers, phallic stage. Boys usually relate to moms and girls relate to dads. Also, they're going through that exploration of knowing that they have different body parts, going through that potty training, right? And they're into that masturbation and touching themselves. Part of the phallic stage, it's normal. I mentioned already the latency, same sex peers, and then genital. Well, think about adolescents. Their hormones are raging and they're out and exploring themselves, whether with opposite sex, same sex, whatever. They're exploring those sort of things, their bodies. Now, Kohlberg. Kohlberg is all about morality. Now, infants and toddlers don't really have something here because they don't understand quite yet right and wrong. But as we get to your preschoolers, they know what's right and wrong and they understand it because of punishment and reward. I do something good, I'm going to get a reward or I'm going to get a praise. And if I do something bad, it's I'm going to be punished. Now, the convention level goes now into your school age children. School age children love to please their adults. They like to do what's right. They don't want to do wrong. And that's what that means. And then post conventional is more of your adolescence. And that's just the whatever the rules of society are, as simple as driving a car, stopping at a red light. That's the rules that you need to do. You have a crosswalk, you have to push the button before you can cross the road. These are just general rules that accepted by just society. Now we go into Fowler's faith construct. And basically what we're trying to say here is that there are all different sort of religious beliefs. Now, you don't have to agree or believe in anybody's spiritual or religious beliefs. You just need to know what yours are. So you begin with just know what your spirituality beliefs are, and then you need to give that child and family, maybe it's they need to pray 6 times a day, or maybe it's a diet that they need to have, that they are getting what they need. So that's what faith is. It starts with you knowing who you are first. Now, Piaget is all about thinking and learning. Think about an infant. They're born and we have to smack their butt or smack their feet to get them to breathe. They don't know how to breathe, right? First thing they do. And then it's sucking, swallowing, and breathing because now they're feeding. That's the first thing that they do learn. So birth through 18, 24 months, this is now taking a rattle and finally grabbing it voluntarily. And all of a sudden it moves and it makes a noise and they go, oh, I like that noise. And they do it again. And then taking that rattle, they're thinking it accidentally went into the mouth and they went, ooh, I like that mouth. And that's your primary circular. Then it goes into secondary circular reactions like you're sitting in a high chair, they're eating, and the sippy cup knocks on the floor, and mommy is comes around and says, oh, here, let me get it for you, and puts it up. Well, they know if they knock off that cup again, mommy's going to come and pick them up. So they want mommy. They know how to call her. Maybe she's in the kitchen doing dishes, right? And that kid wants her right next to them. That's how that happens. And then tertiary circular is more like learning how to imagination and magical and more of the more like pre-operational type things. And it's starting to take their arms out and be in an airplane and having a broom and being a horsey. And again, it's just more magical. Now, as we get to school age, concrete operational. Think of concrete as something you can feel, you can touch. Okay? So they've seen it before, whether it is how another child responded to something that happened. It could be something they've seen being done before. They can replicate it, they can do it. That's concrete. They felt it, they touched it. School age. When they get to the adolescence, adolescents can fight their way out of a paper bag and never been there before and never seen it before. They can think abstractly. They can, I always say, adolescents are, mom says, you're not going out on Friday night with your friends because you did, da, 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 da. Well, that was Sunday. And you've got all the way to Friday night to change your mom's mind. Well, that adolescent is going to take the garbage out and do the dishes and put their clothes away, get an A on the exam or whatever. But nobody taught them that. They figure it out. That's formal operations, and that's adolescence. So here's some little examples about all of them. You can look at them slowly so that you can go, further with them. Now, play. Play is one of the most important things. I think even us today play. Don't you have a game on your phones that you play with, when you're sitting there and have a moment? Well, you may not have moments as being students, but many people, right? So play is always important. Now, types of play. Onlooker, you're just looking, watching. That's it. Solitary, you're playing alone. Parallel play is toddlers. What does parallel mean? You have a child here and a child here next to each other, but don't you touch my toys. I'm playing with my own, you're playing with your own. They're separate plays, but they're next to each other. Parallel play toddlers, right? They don't share. Now, associative and cooperative. That goes more into preschoolers and school ages. Associative is when two or more children play together and they share all the toys together, but there's no goal. They don't build a house or build a train track or build a sandcastle. It's just they're just playing. So there's no outcome. Cooperative play, there's a goal. Something happens. Okay, let's build a house together. Or oh, let's get that train track together so we can roll the cars around on the train track. So they create something. There's a goal in the end. Very important thing plays to understand. Now, cultural differences, as I said, even with religious, you don't have to believe in, you don't have to understand, but you need to give your families, because remember, it's family centered care, the ability to practice their own culture. Again, you always make your provisions for spiritual care by understanding who you are first. And then how do you find out? Well, when I moved to Florida, I was never around a lot of cultures. And then now I'm in Miami, and oh my goodness, it's full of it, right? So I have learned. So tell me, is there anything special that I need to know about you? Any special foods or any little practices that you have to do so that I can work my schedule around you? I'm telling you, if you do those things, these parents will love you forever because you gave them the opportunity to tell, this. It could be as simple as some of them, they don't want male nurses on their daughters. It's against their religion, right? Or it could be even food, vegetarian or no beef or no pork. You would make sure that there was no sausage on their breakfast tray, right? Because that would be something that would be against their religious beliefs. And that meant that you didn't care. and you don't want that for your patients. So assessments, remember, it is never head to toe. Never. That's only adults. That's health assessment, where you did your head to toe assessment. Forget it here. In pediatrics, you need to, first of all, with doing assessment, you need to get down on their level. Don't ever stand above them because you're like this big meanie person and you're scary. And I'm a large girl, so those, kids could have been afraid of me. I would always sit actually almost below them. So I'm on their level. Then I would do something so now I'm not scary. Maybe it's giving stickers or maybe talking about, oh, you've got cute little light up sneakers. I love those things. Or where'd you get those big blue eyes? you know, depending on the age of the child, right? Always based on developmental levels. Now, infants. You have an infant who's asleep. This is the perfect time to listen to heart and lung sounds. When they're awake, they're cooing and moving and scooching, and you can't hear a thing. So if they're asleep, listen to heart and their lung sounds first. And always least to most invasive. For instance, I'm going to listen to them first, and probably the last thing I'm going to do is a blood pressure because squeezing that arm or leg, it hurts them. And that would be scary. So always from least to most invasive. When you have a child who's had some sort of injury, a broken arm, or maybe it's a laceration or something, always make sure, because remember, we're the advocates to our children. Make sure that we question the mother, what went on. And then if we can get that child alone, find out what they're telling you, because you always don't know it could be child abuse. Now, I've seen some horrific child abuse in my career. Some is very blatant. It's not, you can't miss it, but some are very, very subtle. And then also, if the injuries don't match, the story, again, you need to question it. Now, sometimes parents bring children in, all ages, of a question of sexual assault. Now, yes, we're concerned about the child and all of those things, but that parent's hurting. Remember to think about the parents and their feelings too. Okay, sometimes they do need a hug, or maybe they need a social worker or somebody there to help you. And then another thing is called Munchausen syndrome. Munchausen syndrome is when someone, could be mother, could be father, caregiver, that is doing things to keep the child sick because they like that attention. It's things like taking toilet water and putting it in the IVs, I've seen, taking wounds and putting dirt in them or things, to keep them infected. Now, if you suspect Munchausen syndrome, your job is to whoever is suspected of being that person, that if they're in the room with the child, somebody's there. And if they bring things in, that all needs to be inspected. Now, that child doesn't need somebody there all the time. Just when that person, that mother, that father, whoever, are in that room with that child, that we have a caregiver in there. It could be a, nursing tech, or it could be you. Doesn't matter, but they need to be monitored. Growth. Nutrition, 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 nutrition. You don't put fuel in the tank, the child's not going to grow. Their brains are not going to be what they should be. So, how do we know a child's getting enough nutrition? Well, what do we do every single visit? We do a height and a weight, don't we? In adults, they say, so how much do you weigh? And I can lie every single time, right? They would never know. But in children, we do a height and a weight, and we could tell by the way the child's gaining weight and getting taller if they're getting enough nutrition. It's the first thing that we think, nutrition. So, infants are born at 7 pounds. At 6 months, they should double it, be about 14 pounds. And by 1 year, they should triple it. So if, let's say, at 6 months, they should be 14 pounds and they're only 10, we need to look at that. Maybe they need more calories per ounce of whatever, or rest fortifier with more calories for it to increase the calories to let that child gain the weight. So, too much, too little, we can do an intervention right away. One of the things with anything nutrition, any age, if there's a question, they're too thin, too heavy, always think about doing a 24-hour diary. What did they eat yesterday? How much did they eat? This could be adolescent, school age, infants, doesn't matter. When you're concerned about their weight not being right, it's the one thing is to do a diary. Now, the other thing, we look at nutrition, we look at adolescents, and then we give them something called a BMI. It's a body mass index. Now, I'm not going to have you do those formulas, no. But what you need to know is if you're at an 85 percentile, you are considered overweight. And when you're up to that 95%, now you are overweight, you're obese, okay? Those are the two differences in the numbers there. And again, food diary can help, figure out what's going on and how we can make changes. Now, developmental assessments, why are they important? Well, we also know we can institute early interventions. It could be something in school. The school has programs. In Florida, there's all different things that we have that they can use for them to catch up. And it's whether it's speech, physical, occupational therapy, those things can be instituted. And children are great, they catch up pretty quick. Now, there is a cardiac assessment. This is something actually you do in your capstone sim. They want you to listen to the heart and tell you where all of the, valves are. And it's just a picture to show you, where you might see them. Now, the one thing, that you need to know about the heart is about the infants. And the infants, remember, we need to, if they're asleep, do it that way. It's the best. And count for 1 full minute. It's at the fourth intercostal space, okay? Breath sounds. Now, children tend to have big runny noses full of mucus. And sometimes it sounds like there's rhonchi all over the lungs. So if we can listen to tracheal, bronchial breath sounds, we can figure out is it upper airway or is it the lower lungs? So that either listening to by the suprasternal notch in the tracheal, this is going to be, okay, that noise is coming from up here. And then you listen to the lungs, it's a referred sound. Sometimes we suction the nose out, or an older child blow the nose so we can get some good sounds. Vesicular is definitely the lung fields. Car seats. Car seats are important when they're infants. They should be in their back seat, rear facing in the middle of the car, and it should be there until they're 2 years old. Now, there's a way to make sure that they are safe. Harness, safety straps should fit snugly. And then you could take blanket rolls and roll them in so that they're nice and, secure in there. Because, you take a baby home from the hospital, they're so tiny, they're like all over the place. They have those nice head things and whatnot, but blankets work really, really well. At 2 years of age, again, you could put those car seats front facing. And remember, car seats do have an expiration date because they get better as they go. I remember that little metal car seat right there. And we sat in the front seat as infants. So look at the changes that have been done, right? Now, infants. I think growth and development is the most difficult thing to remember, isn't it? So let's look at the couple things that, we need to know. Well, what is a head lag? So when you pick the child up off its back on his arms and its head lags back. That means there's no neck control. We know that the neck should have control by about 3 months, 4 months, right there. It should come up and the neck should be nice and strong. When you put a baby to sleep, of course, it's back to sleep to prevent SIDS, right? Rolling on these infants, they start from their tummies and they turn over about 5 months. And actually, 6 months, they turn back, on their abdomen from their back. So, rolling over, why do we need to know that? Well, if they're 5 or 6 months old and we put them on a bed or a changing table, we better make sure they're strapped in because they're going to roll right off, right? And this would be something safety we would teach. They like to put their feet in their mouth when they're on their backs. They should be able to grasp objects about 3 months. Remember, it's reflex at first and then it becomes voluntary. And of course, everything goes in their mouth. They say the earliest teeth usually come in is about 6 months. It doesn't mean all children are at 6 months. My kids never had teeth till 15 months, and then six came out, which was normal. They can pull themselves up about 9 months. And then this is one of the questions is sitting unsupported at 8 months. That means they can sit there with no propping by themselves. And because of gross motor, the whole thing, they should be able to attempt or be able to take steps at 1 year old at 12 months. Now, colic is gas, and these children cry a lot. And it's really hard for these parents. Usually it goes away about 3 to 4 months of age, but these poor parents have had 3 to 4 months of this kid crying all the time, and there's really not a lot that you can do with it. It usually starts about 2 years, 2 months, 2 weeks, sorry, and then they start with this gas. Yes, we start, breastfeeding, bottle feeding, it doesn't matter what it is. Now, one of the things with nurses, we know colic can happen. So we know it can be, quote, normal. But if you ever get a phone call about an infant, let's say you're in the doctor's office or in the ER and a parent calls in and they're saying their infant's crying more than 8 hours a day, don't ever assume it's colic. It could be a lot other things, okay? They need to be seen. And think about infants. They have no immune system, no backup. There's nothing there. So you don't want them to not be seen. It's better to be seen and it be colic than not be seen and be something more severe. So sequential trends, developmental pace, and sensitive periods. Well, sequential trends is what happens in a sequence, right? Head lips up, then they take and they go from their abdomen to their back to their abdomen. Then they're up on their knees and they're crawling. And then they're up on their feet around the furniture, crawling around, called creeping. And then they start to walk, okay? Also, sequential is, even the grass, the way they do it. We know what's going to be happening. Developmental pace is every child's different. You might not have a child roll from the abdomen to the back first. They just might be doing it all at once. And that's okay, as long as they're progressing forward. And then the sensitive period is when they periods where they start to learn things like language and movement and becoming more adept at that. Fontanelle soft spots. Babies are born with two. The one up top is the anterior. The one in the back is posterior. Well, the one in the back should close about 6 to 8 months, the posterior fontanelle. And the one on the top should be closing about 12 to 18 months. Now, why do we need to know that? Well, what if they close too early? Or what if they're still open? They're still open, that means there's a lot of pressure in the brain. Maybe there's hydrocephalus or something. So these are important things to remember. Now, babies are born with two eyes that don't work together. This eye works and this eye works. And then somewhere by 12 months, you're going to, well, 4 months, they start working together. But by 12 months, Now they have that good depth perception on it. So just knowing this binocularity is these eyes don't work together at first, and then they do. And that helps with that depth perception. Now, pain in infants. What do you see? I think this is very classic. Infants who are upset, even, your older children, they're going to be crying. They're going to be grimacing, that little crunched up forehead and that little chin just quivers, and their eyes are closed real tightly. And then you might either have a child who won't move because they hurt so bad, or they're thrashing. And many of them are really unconsolable no matter what you do. So what we need to do is, figure out what do they need. Remember, a pacifier is a great thing for soothing, and actually it helps with pain. I've told my class, neurophysiologists at Harvard did a study of a pacifier with sugar water on it, sucrose, and morphine, and found out with procedures there was no difference in pain control. My grandson had a circumcision with a pacifier and sugar, and he cried because he was being held down, not because it hurt. So things like non-pharmacological interventions help. Sometimes it's positioning. That baby could be crying because of gas, et cetera, et cetera. So using these things along with maybe some acetaminophen, and then of course if it's a surgical something, morphine or whatever else it might need. So SIDS, this is something that has been researched, since the 90s that I know of. And what they say is children who are placed on their back at bedtimes have a decrease in SIDS death. And it's usually up to 1 year old that SIDS occur. So it should be a firm bedding, no blankets, no, those bumper pads used to be really cute back in the day, but nope, we don't do them anymore. They should not be in the bed with the adults. I've actually seen a father roll over on his infant and the infant died during sleep. Yes, it did happen. It was a larger man and rolled over on his infant. It wasn't meant to, it happened. So we just don't say that we should do that. Having that baby too covered up, too hot. If you're comfortable, infants, depending on the age, you don't have to overdress them. Smoke is always, whether the mom was smoking or that secondhand smoke in the house, there should be none. If they had no prenatal care, and then what if they had a recent viral illness? What this means is they have mucus in their nose and they're obligatory nose breathers. Put some mucus in their nose and now they can't breathe as well. So that viral illness could cause it. Moms less than 20, those premature or low birth weight babies, absolutely, and male more than females. The breastfed babies have a decreased chance for SIDS, and formula have more of a chance for it. So let's look at their reflexes now. So we have the rooting, the Moro, we have the grasp, the step, the Babinski. So the things that you need to know is we know the grasp is that, reflex and then voluntary, and then it goes to pincer. Then the Moro is that startle. That is, you hit the crib and they put their hands and their feet up. And that's one of those things, Moro or startle, that you see those things. The rooting is when you touch their little cheek and they look for a breast or a bottle. And then Babinski, just like adults, do the bottom of their feet and the toes splay. Same thing. Another reflex is the parachute reflex. Have you ever seen a cat land on their back when you drop them? No. They put their hands and their feet down, right? Their paws. Well, infants do the same thing. So what they do is put their arms and their hands out when you turn them over to put them down, like into a crib or into a playpen or on the floor. Their hands and feet automatically come up. and that starts about 6 to 9 months. This also will go on forward, and that's why children have a lot of broken wrists and arms because they still put their hands out when they go to fall. It's a reflex that they keep. Now, nutrition. First 6 months of life is only breast milk or iron fortified formula. If a mother cannot be fed, she can't do breastfeeding or doesn't want to, the only other choice is iron fortified formula. Okay, we do recommend that breastfeeding should be up to 1 year old. And then they say 8 to 10 minutes on each breast. Now, babies do lose weight when they're first born, up to 10%, and then they start gaining weight. One of the questions parents have, especially if they've been in newborn ICU, is I don't know how much they eating because you were measuring everything and I don't see it here. Well, as long as they have 6 to 8 wet diapers, they're doing good. And also, if they're gaining a half an ounce per day for the first 2 months of life, breastfed babies should be getting some vitamin D every single day as part of their supplement. Now, the second 6 months, we start introducing food. We start with rice cereal. Rice cereal has been shown to have the least allergies towards it. And we wait 4 to 7 days in between each changing of food. When we're giving foods, we never, if we're buying them at the store, we wouldn't have like mixed vegetables or peas and carrots, just peas or just carrots, one at a time, every 4 to 7 days, and then you could add another. What would be an allergic response to food? It could be a diaper rash. It could be an overall rash. It could be vomiting, diarrhea, extra gas, abdominal pain. Those things all could be part of an allergic response. So the parent needs to look really closely. Whole milk can be introduced at 12 months. Now, it's whole milk because the central nervous system, the brain, needs the fat. We don't stop fat introduced in the diet after they're 2 years old. Even if they're large infants, no, we will not stop the whole milk from them. And then another thing is soy based yogurt can be introduced at 6 months, and that's for a dairy alternative. Now, immunizations, first year, there's a lot of them. There's 2 big pages in your book all about these things. What you need to know is hepatitis B is the first one. And we give that within the first, usually 24 hours of birth. The second one is at 1 to 2 months, and third when they're 6 to 18 months, depending, being sick and all of those things, as long as they're given in there. Know that influenza is not given till 6 months of age. And another thing that's concerning about parents is, remember, 2, 4, 6 months, we're giving 4 different, usually, immunizations at once, and they're concerned about that child and the pain. Remember, we can do a topical anesthesia there because it's all in their vastus lateralis, in their thighs. And they do get little swollen, a little reddened, little warm. And remember, these children will run a little low grade fever. Body's making antigens for these immunizations there. We can bicycle the legs, put the knees up and down like a bicycle. That works in those immunizations. Also, we can put a nice little warm pack on there, and then give the acetaminophen every 6 hours so that the child's going to be not so uncomfortable. But that topical anesthetic, I think parents really happy to hear we can do it. And that's the schedule. So when does the head and the chest circumference become equal in children? You learned in OB that the babies are born, their heads are bigger than their chest. By 12 to 18 months, they should be equal, or the chest should be larger. That's normal. So if you see the head still bigger after that time, there's a problem and it needs to be investigated. Again, knowing these developmental things can help you identify these things and get some early intervention into these children. So again, we've talked about it once, talk about it again. You're going to approach a toddler. You're going to get down below them. Sometimes you have a child who's just irritable and crying. It's if you get down below them and you start working with them again, maybe you've given stickers. I mean, toddlers, you know what stickers are, or something um, that you think they would like. These children, will tend to calm down, or, oh, where are your eyes? I see pretty blue eyes. They can point to them. Little 2-year olds can do those sort of things. And again, from least to most intrusive. And one of the programs I developed for the hospital system down here is called Huggies. And it's the and it's an acronym, H period, U period, G period da da da. It's help us give great injections efficiently and safely. Well, not only does it do that, that child is held before, during, and after an examination, and they feel less stress because mommy's still holding them. So if mom wants to hold them, oh, please let them do it. And when you're working with them, make sure that you're slow, again, from least to most intrusive. And then, of course, always use play. Remember, toddlers like to play. So, pain. Pain could be a couple things with these children. It could be they're not wanting to play, they're not eating, they're crying. Things like that could show you toddlers in pain. I mean, if a toddler is not out playing, getting into everything, and just sitting there, something's wrong. So, knowing your pain scale is very important. From 0 up to age 3, so one day before 3, is flack. And this is basically looking at their faces, their legs, their activity, their crying, and their consolability. Okay. And it is a scale that we use for those young children, also nonverbal children. We can also use it. As I said before, even with infants, use some sort of distraction, use all these other non pharmacological strategies because they help. And especially you're talking toddlers, you can distract them. You can have an iPad. It could be that they just had surgery, an appendix surgery, and their tummy hurts, elevating the head of their bed so it doesn't pull. Music was something I use all the time, actually, in the newborn ICU and the cardiac ICU all night long because I work nights. Music would be going and these children would sleep. They just loved the sound of that, not the ding, ding, bang, bang of monitors. And of course, massage. Older children, it could be hot packs, cold packs at repositioning and, giving that older kid, giving him one of their video games. I mean, Robo-Blocks today. Let them start playing it and they forget they hurt anywhere. And again, if you're giving pain medicine, know that you try to give it so it's not going to hurt. So we know injections hurt. So intranasal or oral is great. And if you have an IV, putting it through there, they don't even feel it, okay? And of course, if we need to give an IM injection, they don't have it, use that topical anesthetic. Toddlers don't grow as fast as your infants. You don't need to know all the absolute numbers here. Don't go crazy with that. Know that the birth weight would quadruple about 2.5 years, and know that there is stair step. They get a little pudgier and they grow, and they get pudgier and grow. And by 2, they're about half the adult weight. Their nutrition, they've gone from eating like ravenous, like I can't get enough infants because they're growing so quick, to these children who barely eat. They go into what we call a physiologic anorexia. They're picky, picky, picky. There's some toddlers that only want chicken nuggets and macaroni and cheese and apple juice. That's it. Don't try anything else. Don't try to give them broccoli or whatever. So the thing is, actually 1 tablespoon of food per year of age is all they need per feeding. Motor development of a toddler, they're getting more and more refined. They start out waddling, walking, and now they're getting more coordinated. They're starting using both hands. They're walking up steps by about 18 months, and they're throwing a ball. Remember, toddlers are parallel play. By 1 year, infants do have mommy, daddy, nana, milk, whatever, usually one word sentences. By age 2, they're using multi word sentences and they're now starting to feed themselves, play, dress, and undress themselves. Now, it may be dressing them inside out, not right, but they're attempting to do these things. Again, autonomy. They need to try to do it, and that shame and doubt is when you do it for them, you don't let them. Toilet training, we know that 3 signs of potty training is now they're starting to feel their stool and their urethral. They're starting to feel those things. They're understanding you have to hold it. We'll be home in a second. We're out in the store, to get them home. They're starting to understand that. And also thing about toddlers is they do want, to please that parent by going in the right place because they see you do it. So it's somewhere between 19 to 24 months. And again, bowel is before bladder, okay? Because they feel the stool a little bit better and they have that big urge and they know to run to get to the potty. Injury prevention. I love Seinfeld. Having a 2-year-old is like having a blender with a lid. I mean, they're everywhere all the time. You can't keep up with them. They are into things that you didn't even know they'd be into. It is an intense period of environmental exploration. This is me, mine, mine. No, 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 no. Now, children, these toddlers, again, they don't know right and wrong as much, right? What Kohlberg says. But they're doing something wrong. Time out is the best form of discipline. 1 year, 1 minute per year of age. But you need to tell them what they did wrong and then start the time out when they're quiet. So they've learned something from this. If one of these toddlers finds something and ingest the chemical that they shouldn't have done, call poison control before you do anything. They might tell you drink some milk. We do not encourage vomiting or Epicac anymore. We don't. So call poison control and get to that wherever you need to do a pediatric ER if you have one. Now preschool. Again, everything's slower. The body systems are more mature, they stabilize. Remember, toddlers love ritual routine. That's what they, have less stress with. Preschoolers can adjust to some changes in those routine, which is the stress and the change, okay? These children can understand that we're going on vacation, we're going to be at the beach, we're not going to take our nap. Toddlers want their nap or they become cranky, right? Preschoolers are still picky eaters, and they're only going to eat what they want. It's just part of who they are. Kohlberg, what did I tell you? Morality is all about reward and punishment. So they know that if they do something good, they're going to get some sort of, either a verbal or some sort of reward that way, praise. And they know if they do something wrong, it's probably going to be a timeout, right? And they're starting to now understand other people. They can see mommy sick and they'll go up and hug mommy, or they might get your favorite little toy that you comfort yourself with, and they would give it to mommy and say, "Here, feel better, all better." Preschoolers, a band-aid fix everything because they feel like if you cut yourself, your blood's going to come out, your insides are going to come out, and you're going to die. It's exactly what they feel like. So make sure that you have band-aids in the house for this age. I probably have 100 band-aids in this house easily because of my little grandson. And he gets a boo-boo, well, go ahead, get yourself a band-aid. The other thing with injuries and preschoolers, they feel that if they fall down, they broke their arm, or let's say they had to go to the hospital because their appendix, they feel that they're sick because they're being punished because they did something wrong. They hit their sister yesterday, or they didn't listen to mom and put their toys away. They understand that right and wrong, and they feel that their injuries is because they did something wrong. Okay. Now, preschoolers. This is age 3. And your book says at age 8 it turns numeric. So age 3, and it's so cute. So you give these little faces to these children and say, so how much do you hurt? What's the beauty of children is they're not going to say it's a 20 when it's maybe, a different number. Usually there's 0 to 5 or there's 0 to 10, depending on your scale. And they'll point exactly to what it is, okay? So faces is from 3 up to age 8, and they point to a face. Gross motor skills. What can children do, during this time? Well, at age 3, they can walk a line and they can balance. They can start to pedal a bicycle, catch a ball. Now they're jumping with 2 feet. Now, by ages 4 to 5, they can on one foot get on their tippy toes. They can hop on one foot now. When they're running around, they can turn around and, go quickly from one way to the other. Now, the one of the things about now that they're more mobile and they can move easier is that preschoolers don't understand yet the dangers of cars, parking lots, front yards, roads, driveways, and that motor vehicle related injuries increase in preschoolers because they're out chasing the ball into the car, or they're riding their bike down the driveway, down the sidewalk, and then somebody pulls out in their car, right? So these are something about preschoolers is an increase in injuries. Age 6 now. Again, this is the beginning of that industry, what I do well. They can ride a bike, they can jump rope, play hopscotch. So they can jump on one foot really well with hopscotch, right? Remember, anything that you try for a school age child to do is make sure it's something that, even though it's difficult, might take them several times to learn, but they have the ability to achieve it. It's not just things like gross motor skills. It's, for instance, you have a child in a hospital long term, school age child, and you want to do something to give them something to do instead of just watching TV. So you give them a puzzle. You wouldn't give them a 500-piece puzzle and expect this child to do it. Maybe it'd be a 50-piece one. Challenging, but they're able to accomplish it, because if not, they'll get frustrated, and you don't want to frustrate a child. Fine motor skills. Buttoning buttons, they're coloring, they're using scissors. They are, much more coloring in the lines, making shapes. This is all fine motor skills on preschoolers. Now, preschoolers are now getting ready to go to school. One of the things that we need to do is, as teach our parents to make sure that they have a positive attitude towards learning. Reading is a great thing. I know bedtime, one of the routines could be reading part of a book to them. It's a quiet time, getting them ready to go to sleep, and you're encouraging, that books. We know that one of the things with having these children is there's all sorts of programs in schools and things that they can get into, activities, whether it's at the gym, they have all different types of activities that these children be involved with, that does promote their growth, their fine motor skills, etc. And as a parent, talk to them in baby talk. Preschool children are smart. So do speak to them in that full sentences. Communicable diseases, again, we have many viruses, type common colds. One of the common things is chickenpox. And even though there's a varicella vaccine, which is preventing it, right? They still can get it. So I worked in the ER the last 10 years of my career in the hospital, and I would see a child with macules, papules, itchy, oozy, fever. I'm going to immediately get an N95 mask on me because chickenpox is airborne. Okay. Also, because that child now could be, until it's deemed it's not chickenpox, it could get into the air and you have a lot of immunosuppressed children around, get them into one of those negative pressure rooms. And all that means is the air is not mixed with the hospital. It's the air circulates and goes out, filtered, so that it's not going to come in and contaminate another child. And then parents need to be taught. Children can't go back to school after all. That means each of those, every single lesion is crusted and is dried. Okay. Now, children, as I said, can have maltreatment, neglect. We know that neglect is they're not getting things that they need. I have seen food withheld on one child. So I have seen these type of things. It could be emotional, educational, all of those things. Now, remember with children, as a nurse, your responsibility is to protect the child. Okay. That's one of the biggest things with it. So if you think that the story is not matching the injuries, it's something that you need to report to the charge nurse, to the physician, to see, what's going on here. And remember that if this parent brought this child in, it may not be the parent who caused the neglect or maltreatment. It could be another family member at home that's done those things. So remember, that parent could be suffering too. Always remember that parent. Don't ever think. And I'll give you a great example. It was a 3-month-old infant came in, and behind the ear was these yellow, green, purplish type of bruise. And when I picked the child up out of her arms to weigh it, my fingers went into the skull. So I was taking the back of the neck and holding it. And the kid was crying, and I'm like, oh, Lordy, this is abuse. Well, it ended up it was abuse. Um, Not only was there a fractured skull, there was a fractured humerus, fractured ribs, and a fractured femur. This is a 3-month-old infant, and it was not the mother. Okay, it was another family member. So again, as a nurse, it's hard. You just want to blame whoever brought them in there. Don't do that because this mother needed us to be there to help her. Nutrition, right? Trying to get them what they want. They should have about 12 to 1400 calories a day. Remember protein, good for muscle growth. And remember, any age, protein is good wound healing. Okay. Calcium, always for the bones and for the teeth. Okay. And again, you having problems with nutrition, always ask, what did your child eat yesterday? Those diaries, you're always going to see that as the initial answer of nutrition to try to figure it out. Also, remember there are children, let's say we've done a CBC and the hemoglobin hematocrit's low, and we find out they have iron deficient anemia. We need to tell them nutrition wise, you need to add more green leafy vegetables, eggs, meat. These things can help with nutrition, and that parent needs to know it. We don't teach them, they don't know. School age. This is when their baby teeth starts coming out and it ends with puberty. And again, the growth is slow and steady. I mean, between 6 to 12, yeah, they grow a lot, but it's 6 years that they've gone through here. They've gone through the cognitive growth with Piaget. This is all about conservation. And What is conservation? Basically, knowing the environment around them, knowing that just because you have, a younger kid, they have a nickel and daddy has a dime, they think the nickel's bigger and there's more money there. Or that glass of water, the tall, thin one, the short, fat one, you put the same amount of water in each. A younger child's going to pick the long, thin one because it's taller. But as a school age, they're starting to understand the environment, those sort of things in the environment. Remember Erickson, same-sex peers again? And school age is all about Kohlberg, and it's all about pleasing others, okay? There's very little difference between boys and girls, and we know same-sex peers are your friends then. Now, injury prevention. Always, when you think of injury, you always think of the most, it's always going to be motor vehicles, okay? Whether they are in the car or are they ran over by cars. And I've seen many preschoolers come into the ER, ran over by cars, usually in the driveway, usually by somebody they know. One of the things in childhood in that school age is a risk for injuries where there's something going on at home. Stressful home environments could be divorce, could be abuse, could be drugs, alcohol, maybe it's homelessness. If you have a child in these environments, they're at higher risk for injuries because their mind is, so worried about what's going on there. One of the things that we need to teach our school age children is basic rules of water safety. They think they're old enough to go into the pool by themselves and they will drown. Okay. My little grandson at age 2 could do front flips off of a diving board. Guess what? That child, he's 7 today and will not even look at the water without asking me first to go in. So, teaching water safety. Rear seat should be till they're 13. That's something that I didn't know when my kids were small. Booster seats till they're 8. Always remember safety things, bicycle injuries, bicycle helmets, safety equipment for everything. And the one thing is, I live in South Florida, and there's this Chrome Avenue and Everglades, and you will see, I can't tell you on a certain day, just driving down that road, there's these kids on ATVs. It is, and you'll see them at all ages, and it always reminds me of this: not recommended for children younger than 16. And you'll say, well, the parents can watch them. Oh, they take off when they're a mile away. How are you watching them? What if they get lost and they, have no phone signal because out there you don't? So again, ATVs is not recommended for younger than 16. Now, again, any procedures, any age kid, always communicate on their developmental level. I like the one about x-rays, young 6, 7-year-olds know Spider-Man and know all of those characters. And they think that this big thing is going to put gamma radiations and zap through them and burn a hole in them. Okay, they do. They think like that. Remember, just explaining that it's a picture, like a camera, like the phone that's taking a picture, but they look at the insides instead. I will always let them look at the x-ray, especially broken bones, so they can see what has happened, so they know how to take care of it. ADHD is all about inattentive hyperactivity, impulsivity. They don't focus. They go from task to task to task to task. A lot of these children are sent down to the school nurse, and the school nurse works with the child, brings in the parents. The one thing that if we ever become school nurses, which is a great career, um, that these parents, many of them have done many things to try to help their child. So the first of all, don't again make any opinions about what the parents did or didn't do. Listen, and then together make up a plan of care for them. Depression in kids, and they do get it. Older school age and adolescence, and it's that feeling of hopelessness. They're irritable. They don't like what they look like. Their hair is too short, too long. They don't want to do anything. They're eating a lot, they're not eating at all. They're sleeping a lot, they're not sleeping at all. This is all part of a child who can be depressed. Now, the one thing about children, if they ever mention they want to hurt themselves, they want to die, you need to take it seriously. And it could be that their friend said it. Make sure that, that parent does get with that friend, parent, to make sure, because these children will do it and they will commit suicide. Dental health, brushing their teeth before bedtime, flossing is important, but remember, first graders still don't have the manual dexterity to floss properly. So it's the older kids. It would be six-year olds. You would be helping them to floss. Fluoride toothpaste, and losing teeth does not mean a child has poor dental health. Because remember, they're going to lose all their teeth. They have baby teeth. But if their teeth hurt, that is cavities and that does need treatment. Okay. Chickenpox again, I mentioned it earlier. And these are the things: elevated temperature, papules, vesicles, rash, itchy, etc. And again, put on the mask, and those lesions have to be healed up before they go to school. Now, Ray's syndrome is because you've taken aspirin, but not only taken aspirin, it's that you've also had a viral infection recently. One of the big viral infections is influenza, right? So, influenza took aspirin. This is be a child that could get Ray's syndrome, okay? So it's children and teenagers recovering chickenpox or flu-like symptoms. Never take aspirin. We should always promote acetaminophen and ibuprofen. So adolescence now, talking about adolescence and sexual history. Well, many adolescents will not talk in front of their parents. So you can ask parents to leave the room, and you can stand there, let them talk, listen to them, and they're going to tell you some stories. I'm telling you, I've been told some things that my jaw wanted to drop, but you just try to keep that poker face. Again, sense of identity. Who am I? Also, they want to go out, they want to go and do and be what they want, come home when they want. Again, they're always testing the boundaries. They're fighting for that independence and control. Okay. They're trying to break away from mom and dad, and they're experimenting with all different sort of things. Again, body image is huge. And if they don't like themselves, again, this is something that can cause depression. And remember, depression can cause suicide. So the leading cause of death in adolescence, suicide. Well, cars always is number one. Suicide and then homicide. They think that now they can take dad's gun and look at it, don't realize it's loaded, and they can shoot somebody. And that's the way those accident happens. But again, motor vehicles first. But you can see suicides right there. Now, nutrition in adolescence. Adolescents tend to be very busy. They are on the go, go, go. They grab a power bar and a bottle of water, put it in their backpacks, and go for the day. And they want something that's quick and easy. So sometimes their nutrition isn't what they should want. Now, they could be too heavy or not heavy enough, right? Again, there's a 24-hour diary. There are disorders they can have, or anorexias, bulimia, and these are children, those adolescents. I'm too fat. I need to be skinnier. And, this is part of adolescence, and it's something to look for. Adolescents do get hepatitis B and HPV vaccines, to make sure that, for cervical cancer in uh, the girls, but it's both boys and girls. Okay. And it's a 3-shot series that's given. It's the HPV is the one that we start with girls and boys. Now, again, you've got an adolescent. They're hard to talk to. They don't like adults. And you're going to be an adult as a nurse talking with them. So, again, have the parents leave the room if you need to, and give time to get the rapport. I mean, I would build rapport as in, I'd see them listening, to music in their ear pods, and I'll say, "So, what are you listening to? What sort of music?" And I might know what that music is, or they might have a sports team shirt on. "Oh, you like the Yankees? Yeah, I'm from New York." Little things that start making you less threatening. So again, that interview, as I said, um, they're talking about sex. Let's say they come and they're saying, "Well, mom doesn't know it, but yes, I'm having sex. What can I do? What sort of contraception?" Can you talk to that adolescent? Well, the answer is yes. And what you do is just give them oral and written information. And you do not need a parent's permission to do that. Okay. If they're asking, you can give them the information. Adolescents should get a lot of sleep. In the very beginning, they're going through that pre-adolescent growth spurt, growing like crazy. They should be sleeping, but they're not. And why? Well, they're doing their homework. They're going out to social activities. They're texting on the phone. They have a new boyfriend. They're awake all night long, right? So it does affect them, but they need to be taught that they do need to get enough sleep, because eventually it's going to catch up with them, right? Again, depression, suicide, I've already mentioned the things that you might see. Another one is a decrease in school performance. It could be, let's say, that you realize you're gay, and the parents aren't going to accept these sort of things. All of those things can cause depression, suicide. So, again, some of these things that can cause it: life events, losses, if they're using any sort of drugs or alcohol, and then if there's any violence, physical, sexual, emotional. And we don't think it's there, but let me tell you, there's a lot out there in our environment, so we need to be aware of it. Now, tanners, this is all about the adolescent and growing. We look at number one, stage one. This is the young child. And then all of a sudden, they start with breast buds, girls. An enlargement of scrotum and testes is stage two. Then at stage five is all mature. The hair, the breasts, the penis, the growth, all of that stuff has, come into light. They're now full grown, adults. So there are questions. I saw one on a Hesse about Tanner stages. If you know two is the start, and five is mature, you can sort of figure out what the in between is. When they start with puberty, so that's the beginning of those breast buds thing, usually menstruation starts about 2 years after. Okay. In the beginning of menstruation, it's extremely common for girls to have irregular cycles. They are gaining weight, gaining height. Remember that all that growth is occurring in that 12 to 14 area. And hormones going crazy. They can be moody, and that's all with that beginning of puberty. Remember, there's dosage calc. I'm always here to help you with it. Here's some videos that are on the end that you can watch, or you can go to my YouTube channel. Here's your Kahoots. You want them? Everything in one place. And anybody has any questions about anything, you just let me know. Any questions?